Medicine and the Med Center have teamed up with what they call an innovation design unit, the first phase of the $2.1 million project healthcare facility.
First Alert 6 reporter John Chapman tells us that technology and changes to healthcare worked out in the IDU will be rolled out in the entire hospital, as well as Project Health.
The innovation design unit will help define what healthcare looks like in the future.
What would you do?
Doctors tell us how we provide health care has to evolve, and the way we do things in the hospital setting now is not sustainable.
If you look at studies published in the New England Journal of Medicine, it actually shows that medical error is the #3 cause of death in the United States.
The Innovation Design Unit will allow medical professionals to test new ideas on how to improve patient care and put those ideas to work right next door in a patient care environment.
We almost think of this as a living lab, giving our clinicians, our researchers, our educators space, resources, and time to really innovate and think differently about the way that they are delivering care.
The redesigned hospital rooms focus on patients and their families. The rooms have more space and are more comfortable for families who are dealing with the challenges of a hospital stay.
There are challenges if family can't be at the bedside, knowing what is going on, what the care plan is, knowing even who walks into the room, or making sure that there are 2 nurses double checking things at times.
Many of those challenges are solved by the use of technology, a large digital care board replacing the whiteboard and marker, making it easier for patients and their families to be more involved in their care.
The care board also helps patient and family members see what type of assistance the patient needs to get up and move around. A pain scale appears on the care board, as well as when doses of pain medication have been given and are next coming up.
The care board can also change into a big screen television. All of the suggestions for change to make patients safer and more comfortable come from the people who use these rooms.
About a year ago, a little more than a year ago, Nebraska Medicine brought together patients and family caregivers to provide insight and help guide development in this innovation design unit.
I think we can be so much more patient-centered, so much more family-centered, and almost as important, we can be more centered around the team, the nurses, the physical therapists, the nurse assistants, the care techs.
In Omaha, I'm John Chapman, First Alert 6.
The Innovation Care Unit has room for 17 patients. The first patients are set to move in on the 7th of January.